Embarking on a fertility journey can feel like navigating an unknown land. You and your partner may have received a lot of information. Sometimes that information can be confusing or overwhelming. One term you may have heard is testicular biopsy. It sounds medical and maybe frightening, but think of it more simply. It's a procedure that helps find answers and create possibilities. It can either check for sperm production or retrieve sperm directly from the testicle. This can be an important step on the path to parenthood, often discussed when a man has Azoospermia. That simply means no sperm found in the semen. Hearing that can be hard. It can bring up many questions and emotions, but this isn't always the end of the road. Often, sperm is still being made inside the testicles. It just isn't making its way into the ejaculate. A testicular biopsy helps us understand why, and it can help us find sperm to use for conception. There are two main reasons for no sperm in the semen. First, obstructive azoospermia. Imagine a road blocked by a fallen tree. Cars can't get through even though they're there. This is like blocked tubes that carry sperm. The testicles are producing sperm, but it's trapped. Second, non-obstructive azoospermia. Here, the testicles may make very few sperm. Production is so low none reaches the semen. A biopsy shows which situation you're facing and guides treatment. A testicular biopsy has two purposes. As a diagnostic tool, it gives a tiny piece of tissue from the testicle. A specialist checks that tissue under a microscope for sperm production. That information is incredibly valuable. As a treatment, the procedure lets us collect any sperm we find. That sperm can be used in treatments like IVF with ICSI. This process can open a door to parenthood that felt closed. It's a hopeful step forward. That can really matter. When we talk about retrieving sperm from the testicle, there are two main methods we use. They have similar sounding names, which can be confusing. Let's break them down into simpler terms. The first method is called TESA, which stands for Testicular Sperm Aspiration. Think of this as a less invasive approach. It is often the first choice when we believe there is a good chance of finding sperm easily. Your doctor will use a very fine, thin needle, pass it gently into the testicle, and aspirate a small amount of fluid and tissue. This sample is what the laboratory team will examine for sperm. The entire TESA procedure is quite fast. It can often be done in a doctor's office or a small procedure room. You will be given a local anesthetic to numb the area, so you will feel minimal discomfort. Some patients may also receive light sedation to help them relax. Because it is less invasive, recovery from TESA is typically very quick. It is a good option when sperm production is thought to be normal but blocked. The second method is called TESE, which stands for Testicular Sperm Extraction. This is a slightly more involved procedure, best described as a small surgical biopsy. The surgeon makes a tiny incision and removes a very small piece of testicular tissue, often about the size of a grain of rice, then sends it to the lab. Because they can see the tissue, they choose the best area. There is also a more advanced version called micro-TESE, using a powerful operating microscope. The microscope magnifies testicular tissue and reveals the tiny tubes where sperm is made. They can identify the healthier, fuller-looking tubes more likely to contain sperm. This is especially helpful for non-obstructive azoospermia, where production is very low and patchy. Micro-TESE maximizes the chance of finding sperm while removing the smallest amount of tissue necessary. TESE and micro-TESE often require deeper sedation or general anesthesia. Right? So that's basically the distinction. Knowing what will happen can help reduce any anxiety you might feel about the procedure. Your journey will begin with a consultation with your medical team. They will review your medical history. They will explain the specific procedure recommended for you. They will answer all of your questions. You might need some routine blood tests before the day. You will be given instructions, when to stop eating or drinking, and whether to stop medications like blood thinners. This preparation is designed to make the day safe and smooth. Arrange for someone to drive you home. You will not be able to drive yourself. On the day, you will arrive, be taken to a private area, and a nurse will check your vital signs. Nurse measures blood pressure. Nurse checks heart rate and monitor. You will change into a medical gown. The urologist will come to see you. The anesthesiologist may come to see you. This is a great opportunity to ask last-minute questions. The team's goal: make you feel comfortable, informed, and cared for. You will be taken to the procedure room. You will lie down on a comfortable bed. The scrotal area will be cleaned with antiseptic to prevent infection. For TESA, local anesthetic injection to numb the area. For TESE, or micro-TESE, sedation via IV or general anesthesia. The team will ensure you are comfortable and feel no pain. The doctor will perform the planned procedure carefully and efficiently. After the procedure, you will be taken to a recovery area. Nurses will monitor you closely as anesthesia wears off. You might feel groggy or tired. This is normal. The team will make sure you are stable and comfortable. You will get instructions for home care, how to manage discomfort, and when to follow up. Most men go home the same day, usually within a few hours. Your driver will take you home so you can rest and recover. Take it easy and follow the instructions. The moment the tissue or fluid is retrieved from the testicle, another team springs into action. The sample is immediately and carefully transported to the on-site laboratory. It is a race against time, as the sperm cells are delicate. In the lab, a highly skilled embryologist will take the sample and place it in a sterile dish. They will then begin the meticulous process of searching for sperm. This is often done under a high-powered microscope, which lets them see details invisible to the naked eye. They carefully separate the tissue using tiny needles and fine instruments to tease apart the small tubes within. This process releases any sperm that might be inside. They then scan the entire sample, methodically looking for any moving, healthy sperm. Finding sperm, especially with non-obstructive Azoospermia, can be like finding a needle in a haystack. It requires incredible patience, skill, expertise. If your partner is undergoing an egg retrieval on the same day, the lab will coordinate everything perfectly. This ensures that if sperm is found, it can be used right away. If sperm are found, the embryology team prepares them for the next step. This is usually intracytoplasmic sperm injection, or ICSI. With ICSI, a single healthy-looking sperm is selected and injected directly into an egg. This technique bypasses issues with sperm swimming or fertilizing on its own. Using fresh sperm retrieved that day often gives the best chance for fertilization. The embryology team handles each individual sperm and egg with the utmost care. Sometimes the sperm retrieval is done before the egg retrieval. In other cases, extra sperm may be found. When this happens, the lab can freeze the sperm for future use. This process is called cryopreservation. The sperm are placed in a special solution that protects them and then frozen in liquid nitrogen. This provides a backup so you may not need another retrieval. Frozen sperm can be thawed later and used for ICSI with very good success rates. The lab's work is the vital link between the retrieval and the creation of an embryo. After you return home, your main job is to rest and allow your body to heal. You should expect to feel some soreness and discomfort for several days. The scrotum area might look swollen and bruised. The bruising can sometimes look quite dramatic, but it is usually not a cause for alarm and will fade over a week or two. Your doctor will likely recommend pain medication or prescribe medication to help you manage the discomfort. It is important to take this medication as directed. Do not wait for the pain to become severe. One of the most effective things you can do is use ice packs, 15 to 20 minutes at a time, several times a day. Wrap the ice pack in a thin towel. This will help to reduce both swelling and pain. Another key tip is to wear supportive underwear. Snug-fitting briefs or an athletic supporter will help to hold everything in place. This support minimizes movement and reduces discomfort when walking. Avoid loose-fitting boxers for the first week or two. Plan to take it very easy for at least the first 48 to 72 hours, resting on the couch or in bed. Most men can return to a desk job or light activity within a few days. However, you must avoid any strenuous activity. This includes heavy lifting, vigorous exercise, running, and contact sports. Wait 1 to 2 weeks or until your doctor clears you. You should also wait to have sexual intercourse until your doctor says it is safe, typically after a week or two, once soreness has resolved. While complications are not common, know what to watch for. Fever over 101 degrees Fahrenheit, 38.3 degrees Celsius, increasing redness, warmth around the incision, Any pus-like drainage, severe pain not controlled by medication, or a large, firm, painful swelling that could indicate bleeding. It is always better to be safe and call your doctor's office if you have any concerns. They are there to help you through your recovery. Rest and follow-up are really key. Going through a testicular biopsy is a significant step, and it is normal to feel a mix of emotions. You might feel hopeful about the possibility of finding sperm. You might also feel anxious about the procedure and the potential outcome. It is important to acknowledge all of these feelings. By taking this step, you are being proactive. Many couples have walked this path before you and successfully had children with help from these procedures. There is real reason for hope. Keep the lines of communication open. Face it as a team. You'll be stronger together. Talk with your medical team. Don't hesitate to ask questions. Write questions down before appointments. Ask about chances of finding sperm, recovery, and next steps, no matter the outcome. The outcome can be hard to process, especially if no sperm is found. Hearing that can be devastating. Give yourself time to grieve and seek support. Talk to a fertility counselor. They provide a safe space to process emotions and discuss other paths, such as using a sperm donor or adoption. You do not have to go through this alone. Support is available and can make a big difference. No matter the outcome, this procedure provides clarity so you can make informed decisions about the future. If sperm is found and frozen, you have a tangible asset for future family building. If used right away for ICSI, you may soon be on the path to pregnancy. This procedure is a courageous step on your fertility journey. It's a testament to your commitment to becoming a parent. You are taking control and exploring every option. That is a powerful, hopeful act.